Hi there today, this is Kevin Chidester with the Wellness Corner from Naples Personal Training. Today I'm with Dr. Otto Jaasko, and today we're going to be talking about injury prevention. And so Otto, tell us a little bit about yourself and your background in the physical therapy and athletic training world.
Hi everyone, my name is Otto. Like Kevin said, I'm a doctor of physical therapy as well as a sports medicine provider here at Naples Personal Training. Through my undergraduate career in sports medicine, I had the opportunity to work with athletes from all sorts of different backgrounds, from the recreational athlete all the way to professional athletes. And then through my doctorate studies, I got some further experience in the athletics, especially with the aging population. So I have a pretty good background in athletics in general.
Terrific, thank you, Otto. So we'll get to our questions. What often ignored lifestyle factor leads to injuries?
So there are a few of these, overlooked factors when it comes to injury risk and prevention. One of the big ones is the adequate recovery, not just from the rest perspective in terms of having days off, but also proper sleep. And it is recommended that athletes get at least 7 to 8 hours of good quality sleep as a recommendation to allow the body systems to recover from the imposed stresses that you put on with training. The other thing that is often overlooked is diet. So it's important that you eat whole food based diet that is consistent and provide yourself with good quality calories and building blocks to allow your body to recover and also build itself with the training.
Terrific. So how should you structure your training to reduce the chance of injury?
So here it depends a little bit on your background and the state of activity that you're in currently. So for example, with professional athletes who are in between seasons and have had a month off or a few weeks off, their beginning of the training for the new season is different than for somebody who is just starting to get into a sport. And here the common theme really is building the foundation. So regardless of your level, you need to have a good foundation to get ready for whatever athletic activity that you want to start engaging in. So usually it demands strengthening as a foundation, as well as the mobility work and things like this, where you build a good strong foundation for the activity and you don't jump right into the sport itself. It goes all the way from things like long distance running, where you really need to build the strength so you don't have overuse injuries, all the way to plyometric activities like tennis, where you need to allow your body to have the strength for the powerful explosive movements, so you reduce the risk of injury.
Great. So when injury does happen, what should you do? Keep playing, rest, or what is your recommendation for after injury?
So here it's important to listen to your body. This is something that professional athletes are, for the most part, very good at. Is they can kind of determine what state of recovery their bodies are at, and then as long as they communicate this to their rehabilitation team, they are usually able to kind of mitigate the risk of the injury with adequate rest and maintenance work. So really, again, the common theme between the athlete, regardless of the level, is that you need to be able to listen to your body, allow for adequate rest. Usually we recommend 72 hours in between plyometric workouts, whether it's the actual training or competition. And this gives you a good chance to work on things that are often overlooked, such as mobility and flexibility, things like that. And the other thing too here that's important is working on, when you get the soreness or you start feeling like you are at a higher risk of injury and you're not performing well, is to allow yourself to still be active throughout, active recovery techniques, stuff like that are a little bit lighter and more cardiovascular work. So you're still training for something, but you're inducing more variety into your training.
Terrific. So if you do happen to get injured, what course of action should you take? Who should you see first, and why?
So this is where physical therapy can really help individuals regardless of their level of activity. In certain situations, it's appropriate to seek emergency services, like when you have a fracture or something like that. But in every state in the U.S., doctors of physical therapy can now see patients through direct access, which basically means that when you have some sort of a musculoskeletal injury, you can go directly to a physical therapist without a referral. And physical therapists are excellent in screening out medical systems where there may be a need for a referral to a medical doctor. We can provide that. And then when there is not, you start getting the treatment and the interventions needed for the rehabilitation process right away, rather than having to wait weeks before you can get seen by a movement specialist.
Okay, very good. And so how should your training change after the injury?
So this is again where it's a little bit different between different levels of activity. With the professional athletes, their foundation is obviously a little bit stronger than the average recreational athlete. But the thing here again is that the rehabilitation process usually is very selective, meaning that it targets specific tissues with the bulk of the work. But hopefully the rehab process also induces some of the sport-specific demands on the body where you don't start right from scratch. But even when the rehabilitation process is done properly, you still need to start building the foundations again. The muscular strength and the endurance and things like that, and the power production before you can go right into sport-specific training where you have a higher risk of injury again. So really building the foundation again and being patient with the process before you jump right back into
what sports and activities are more prone to injury, and how can you prevent getting injured in those sports?
So every sport is a little bit different in terms of the demands that it imposes on the body. Two of the kind of the polar opposites that I usually think of and explain to people are long distance running and something plyometric like tennis. In long distance running and those type of activities, we usually see overuse injuries more often than traumatic injuries. And that's really where the importance of building the foundation and the muscular strength and the endurance for the musculoskeletal system to be able to handle those long distance runs is very crucial. So instead of running a marathon right away, you need to first build the strength, working with resistance training, and then go into progressive overloading with the distance that you're running. Whereas with things like tennis, you are at a higher risk of traumatic injuries like ligament tears and twisted ankles and stuff like that, where again the foundation is important, but it's a little bit different because here your foundational work really depends on you being able to stabilize your joints and stuff like that when you're active on the court. So again, the common theme is building the foundation and then recognizing with a rehab professional or a personal training what the demands of the sports are, and then adjusting accordingly.
Great, thank you, Otto. I appreciate it. It seems like it was a common theme to build the foundation before you start sport or during sport. Just make sure you build that foundation so you're ready for performance.
Yeah, and this is the same between recreational athletes and professional athletes. Usually with the professional athletes, they have very good access to a professional that they work with. They usually don't create their own programs, but they work with a good team of rehabilitation and training professionals. Whereas the recreational athlete usually overlooks these steps, and therefore we see a higher adjusted injury risk in recreational athletes than we see in professional athletes.
And a lot of these recreational athletes just jump right into their sport, whether it be there's a low barrier of entry for the sport, so they jump right in, and that can cause some issues.
Right, and it makes the progress of getting where you want to be with the sport much longer because you're not performing well first of all, but then again if you have an injury, you're adding on months onto your progress that you hope to see much sooner.
Great. So we're going to ask a little bit about yourself so that the audience can learn a little bit more about Otto. Okay? So while you were growing up and as an adult, what sports have you played or are currently playing?
So through my youth and adulthood, I've played many sports. My two big ones have been really ice hockey and soccer. Ice hockey I played competitively through most of my life, so that's obviously my number one sport. But I also played soccer through my youth, as well as pretty much every racket sport that there is, from tennis to ping pong. Also skied and snowboarded since I was, I think, 2 years old. So played lots of different sports. I still play ice hockey and soccer. Occasionally, when I have the chance, I'll go skiing. Really, any time that I have the chance, as well as just staying active at the gym.
Very good. And for the audience that doesn't know, Otto is from Finland. So you were born with skates and skis, right?
That's correct.
And so a lot of winter sports there, I'm sure.
That's true.
And so, which sport is your favorite to play?
It'd have to still be ice hockey. Really thoroughly enjoy it whenever I get to play, but soccer is a close second there. But I also enjoy, being out on the mountain with skis on.
And so, with that, who is your favorite NHL team?
My favorite team would have to be Pittsburgh Penguins. My dad was a huge fan when I was a kid, so I basically grew up being a Pittsburgh fan.
And so, how does a Finnish person become a Pittsburgh Penguins fan?
So he was just a big fan of Jaromir Jagr. When I grew up, I obviously learned to be a fan as well. So that's how we kind of got started there with the Penguins.
And so, which position did you play?
As a winger, and then moved on to goaltender once I learned how cool the gear was, and had the privilege of having my parents buy me some, and that's where I fell in love with being the puck stopper.
That's a tough job.
Yeah.
Not one that I want to volunteer for anytime soon. So a little bit off the sports and a little bit more about healthy and wellness. What books would you recommend for the audience to read that really has helped you in your health and wellness journey?
So I think I can give you two examples. Both of them focus on the non-physical realm of being healthy. The first one being Proteinaholic by Dr. Gareth Davis, which focuses on really educating the reader on what are the healthiest things to eat and why, in a very objective manner, so that you can make your own decisions based on the information. And the other one is Atomic Habits by James Clear, which obviously focuses on the foundational aspects of building good habits. And both of these books are evidence-based, and very little personal opinion in the books. So that being said, you kind of create the knowledge and then you do with it as you wish. But really, both of the books, are aimed at building better, healthy habits and allowing yourself to be the best person you can be.
Great. And so during this pandemic that we're going through currently, what have you been doing to keep yourself busy?
So now that I'm all finished with my doctoral work, I've kept on reading and staying active with the literature, as well as with the rehabilitation community. So lots of reading and trying to stay productive that way, as well as just being active and getting out, in a safe manner, and not just bunkering myself home 24/7 in bed. So
Fresh air is good for everyone.
it is, yeah.
And so thank you, Dr. Otto, for coming and talking to us today about injury prevention. So if our audience has any questions regarding injury prevention, athletic training, or physical therapy, how can they reach you?
So you can reach me by phone or text at 239-324-6824, or you can just shoot me an email at otto.jaasko@ wellnesscorner@gmail.com.
Thank you, Otto. We appreciate all the knowledge that you provided with us today.
Thank you, everybody.
And thank you, audience, for tuning in. And we will see you next time in the Wellness Corner. Thank you.